We'll be answering questions submitted by LA County residents about the pandemic and the coming school year. To start, I want to tell you a little bit about how tonight will go. We'll start with some brief remarks from our panelists, and then we'll spend the bulk of our time answering your questions. As a reminder, you can send in your questions on Twitter, Facebook, or YouTube. Y si quieres escuchar en español, por favor llamas el 1-888-664-1453. As we hit the 18-month mark of having pandemic protocols in place, we are once again seeing a rise in transmission countywide and across the country. We remain focused on the strategies we have available to reduce the spread of the virus. Vaccinations remain the most powerful tool we have for lowering transmission. And we have ample evidence from across the country showing just how effective vaccines are in preventing infection, hospitalization, and death. Vaccine. Universal masking indoors is another key strategy for reducing transmission of COVID and other respiratory viruses. With mounting evidence that the Delta variant is contributing to these very high rates of infection, and it can be spread even by a small number of fully vaccinated people, both the Centers for Disease Control and Prevention and the state of California now recommend masking in all indoor public spaces, regardless of your vaccination status. And that affirms the regulation that's in place here in LA County that requires indoor masking. Masking indoors is something we can and we should all do to keep each other safe. Testing and contact tracing are the third critical part of our approach to slowing the spread of infection. Both help us identify people at greatest risk of spreading the virus to others, and they give us the opportunity to educate those who test positive about keeping themselves safe and preventing onward transmission to people both within and outside of their households. Together, these three strategies, vaccinations, universal masking indoors, and testing and contact tracing, comprise a simple but powerful toolkit that we are using to getting back to slowing transmission and making it as safe as possible when our children return to school. We all have a part to play in making this happen by helping to educate about vaccine safety and the importance of getting vaccinated, by wearing the appropriate mask when you're indoors at workplaces, schools, and public places, by getting tested if you have symptoms or you had an exposure, and by participating in public health follow-up if you test positive or are a close contact. As the school year begins, we will again be starting our Student and Parent Ambassadors Program. The Student Ambassador Program will begin on October 1st, with recruitment online from October 9th, that's this coming Monday, through September 9th. The program offers participants a community of peers, which is so important for their social and emotional needs, and it also helps build their leadership skills and is able to provide them with lots of education that they can pass on to others about COVID-19 prevention. The Student Ambassador Program is open to every single student in all of the high schools across the county, and students can register as you see at this site here on your screen, or they can just scan that QR code with their camera. We're also going to have two opportunities for parents to participate in the Parent Ambassador Program. There'll be an online training that's available to all parents, and it only requires verification that they're affiliated with a school, public or private. Parents who participate will receive education and preparation for speaking with others about COVID strategies for preventing transmission. And you'll also get a certificate of completion once you finish the training. Registration for this program also begins on Monday, August 9th. And you can see from the slide where you can go ahead, scan that code, and get connected to an application for participating in the program. We're also going to have a parent ambassador program that's running through individual school sites. At each site, we're going to have a team of parents who are actually going to be paid, because it'll be a part of their jobs, to receive in-depth training and do outreach to other parents in their school community. Parents who are interested in this opportunity should speak with their principal about participating in the program. By working together, teachers, students, parents, and school staff, we can protect ourselves and those we love from COVID-19. For tonight's town hall, we received hundreds of questions, and while we won't get to all of them, we're going to do our best to answer as many as possible. And as a reminder, you can still send your questions in the chat on YouTube or Facebook, or you can send us your questions on Twitter. We hope that by sharing important information and answering your questions, we continue to work together to protect our children and to end this pandemic. Now, I'm most pleased to be able to turn this over to Dr. Eduardo, one of our just amazing and talented leaders here in LA County. And she'll be able to provide some updates from the LA County Office of Education. Thank you, Dr. Eduardo.
Thank you so much, Dr. Ferrer. Good evening, everyone. Buenas tardes, bienvenidos. We're so glad to be here with all of you and to answer some of the questions that I'm sure you have. You know, typically the start of the school year is a time of excitement. It's about learning. It's about connecting with new and friends and former friends and teachers, and about getting excited about participating in school activities. So it's a real exciting time. However, with so much that's happened in our recent history, this year is going to be different. It's going to be different for many students, educators, parents, and families, but we're all working really hard and collaboratively to make sure that it's a smooth school opening. It's been especially hard for those who've not been on school campus since we had to physically close our schools in 2020 due to the pandemic. And school communities have done an amazing job navigating an uncharted virtual environments in these unprecedented times. Many in our communities have experienced hardship, social isolation, illness, and in some really difficult situations, devastating cases where people have lost a loved one. And as we transition into a new school year, we want to welcome everyone back to school to ensure you that we're going to do this safely. It's going to be done with compassion and grace and understanding, recognizing the trauma that so many of our students and educators, parents, and families have experienced during this past year and a half. LACO continues to work very closely with the Department of Public Health to monitor what's happening in our communities with COVID-19. We are continuing to track and monitor data on a daily basis to provide all of our school districts with current information, recommendations, and local guidance. We also continue to work with our 80 school district leaders that are preparing for in-person return to classrooms this school year. We've been supporting our districts throughout the summer with reopening plans that include expanded COVID-19 testing programs, expanding access to vaccinations for employees, students, and community members, and accelerating learning over the summer and making sure that all of our students have access to the resources and supports that they need. We've also been supporting our districts with independent study, which is a change in the legislation that requires all districts to offer independent studies if a family feels they're not ready to send their child to in-person instruction. So we are excited to be here with everyone to answer your questions and to assure you that the reopening of schools will be as safe as it possibly can be. Thank you.
Thank you so much, Dr. Eduardo, and I'm very pleased to welcome our own state superintendent of schools, Superintendent Thurmond. He will now make some opening remarks as well. We're honored to have you join us tonight, Superintendent Thurmond, and look forward to having you help answer the many questions that are coming in from all of our community residents. So thank you so much for joining us.
Thank you, Dr. Ferrer, for that introduction and for your incredible leadership. Thank you, Dr. Eduardo, and to everyone who's participating in tonight's webinar. And of course, to our students and educators and family members. It is an honor to be joining you tonight from 156th Street Elementary School, the home of the Falcons, to be joining you in LA County in a conversation about the 80 school districts in LA County is a real pleasure for me. It's been great for me to spend my day here today in partnership with the LA County Department of Public Health and talking about the importance of vaccines and to visit an incredible vaccine outreach event today and to bring some resources to try and help encourage those who can get a vaccine to do so. And so it's an honor to always work alongside Dr. Eduardo, who's provided incredible leadership in this county and is one of the great leaders of the state on all things related to education and the kinds of supports that we have to provide to our students, the wraparound supports, the mental health, the kinds of things that come out of our community schools. As we continue to look at this moment where we are, we know that there's nothing more important than supporting the well-being of our students and their families. School is about to open. That's exciting. We find ourselves, though, headed back to school at a time when the things happening around schools have raised concerns about safety. We see cases spiking at a high rate, but we know that we can do this if we do the things that have been proven to give us safety. Again, I can't say it enough. If you can get a vaccine, anyone 12 and older who can get a vaccine, please do. We know that this is literally the difference in saving lives. I am not going to say a whole lot about it because this is Dr. Ferrer's space. But one thing I've learned, Dr. Ferrer, is that those who have experienced the most serious complications from COVID, 99% or more are those who are unvaccinated. And so I can't think of a more compelling reason to say to folks, get a vaccine if you can. Not to mention, allows us to have our schools open, our restaurants, our small businesses, and what I love more than anything, being close to our loved ones. And I don't want to see us be in a situation where we have to continue to be away from our loved ones or that we lose loved ones for safety. As you heard from Dr. Eduardo, we can do this. We can accelerate learning. We can support our students. We've visited with LAUSD. A great shout out to the LAUSD team for an incredible literacy program. Great job to everyone in Cardena and Inglewood and Compton and all the places that I've had a chance to visit. Huntington Park High School, who invited me to talk about vaccines. We know that we can accelerate learning and support our students. We can provide more counselors and support to our students. The state of California is partnering with LACO and with LA County Health Department to provide the kinds of resources that pay for things like rapid COVID tests. People always ask me, Tony, why do you keep talking about rapid COVID tests if we have vaccines? And I tell them that even someone who's been vaccinated can still come down with COVID, and that so that we can be safe and have awareness, we should use COVID testing and masking as part of our strategy for keeping school open for in-person instruction. And so the state's provided billions. I won't go through all of it, but every school, each of the 80 school districts in our county, and I want to give a big shout out to all of the school districts, all 80 of you, for the great things that you do for our students and our families, our superintendents, our administrators, our teachers, our classified staff, of course, our students for the resilience that you've shown, our parents and our families. Buenas noches, gracias para todo. Thank you for what you do to make what happens in this great county happen. And it is the balance of things, wearing a face mask, getting a vaccine, and using COVID testing that will allow us to stay open and to be safe. And I talk about the rapid COVID test because it means that in 15 minutes, we can have results to know if someone needs to safely quarantine or if we, and so how we can keep the rest of our school community safe. If anyone's interested in it, just know that we've worked with the governor and others to get more than 5 million free rapid COVID tests to support our schools, in addition to all the wonderful things that are happening in Los Angeles County, forward-leaning districts doing great things. And so just know that we stand here in partnership with you. We support you, and we're excited to see our students coming back. I'm looking forward to the questions that you all will raise tonight, but I'm most grateful for the learnings that are being shared by those who were presented. I had a chance to reach out to 400,000 California, not just Angelinos, but folks in Los Angeles County yesterday to talk about vaccines. And we want to do more. We want to be helpful. And I believe if we can get it right in this county with our 80 districts and the complexities and the beautiful diversity that exists here, that we can address issues around racial justice, that we can say that our schools are places that not only support learning, but support African-American students and Latinx students and Asian American Pacific Islander students. We support all students, that we create safe spaces for our LGBTQ plus students, that this is where it's happening in Los Angeles County. Let us continue to do what we need to do to be safe, to accelerate learning, to take care of your needs and your well-being. Together, we can do this. And in the process, we will build back an education system that is better than what we had before and provide that for every student in Los Angeles County and ultimately for our 6 million students in the state of California. Thank you. Continue to be safe, and we look forward to working with you.
Thank you so much, Superintendent, for your really wise counsel, but more importantly for the partnership, which we've depended on for the last 18 months, and we'll continue to look forward to your leadership as we, as you noted, head into a wonderful school year for all students. I'm going to turn it over now to Dr. Yagane, and she's going to go ahead and talk a little bit about the vaccination efforts here. The importance of getting vaccinated, of course, and what we can all do together around COVID-19 prevention.
Great. Thank you so much, Dr. Ferrer. I'm really excited to be here to discuss COVID-19 and COVID-19 vaccines available in Los Angeles County. All of us are looking forward to getting our children back into school alongside their friends, their teachers, and to begin repair some of the harms that may have been done during the pandemic. Unfortunately, as Dr. Ferrer mentioned, the Delta variant is the predominant strain in Los Angeles and is likely associated with this increased risk of transmission. Because of this increased risk of transmission, we are seeing increased rates of hospitalizations with over 1,000 people hospitalized with COVID-19. With increased circulation, we also might see more infections in children, which will then affect our schools. So it's very, very important that we layer our mitigation strategies appropriately to really prevent this from happening. Luckily, there are several steps you and your children can take. The first one, of course, is to get them vaccinated if they're vaccine eligible. Dr. Ferrer is right in saying that vaccinations are the most powerful tool we have to create a safe environment for your child and the people they come in contact with. Just as a reminder, the Pfizer vaccine is the only vaccine currently available for those who are 12 to 17 years of age. It's a 2-dose series, and it's given 21 days apart. Once your child has received their second dose, they're fully protected 2 weeks after. This means that you have to plan ahead. Becoming fully vaccinated is a 5-week process. For that reason, there isn't any time to waste. I encourage you all to visit vaccinatelacounty.com to find a vaccine location near you. That might be in a local pharmacy, it could be in a point of distribution center, it could be your child's pediatrician or another physician. And more, the school districts and schools are holding these vaccine events and hosting them in hopes that their communities can take advantage of this one important tool in keeping our schools safe. The second thing, of course, is masking. It's very important to get your child a well-fitted mask that they can wear comfortably all day without readjusting too much. The mask needs to fit the nose, over the nose, the mouth, and the chin, and it has to be worn throughout the day. With the current mask mandate, all persons on school campuses indoors should also be wearing masks. And third, talking to your child about how they're feeling each morning and how to care for themselves at school. I think it's very important to check in with our kids and make sure they're not displaying any symptoms of illness. And if they are ill, we need to keep them home. We also can talk to them about the importance of hand washing and keeping their masks on. These simple conversations can help your child adjust and be ready to have a successful and healthy, safe school year. I'm excited to answer any more questions, and of course, always excited to talk about the vaccine. We have a lot of information available at our DPH website at vaccinatelacounty.com.
Thanks so much. I'm going to move now to Dr. Gilchick, who's going to talk about the school reopening requirements. It's really important to understand that all schools in LA County do have some requirements that they need to meet when they reopen, and that parents and students should feel very comfortable asking questions of their school administrators about the school reopening plans, because every single school has put in place a really excellent plans for a safe reopening. Dr. Gilchick, I'm going to turn it over to you.
Thank you, Dr. Ferrer, and good evening. Thank you all for having me here to talk with you tonight about how we are getting our students ready for the new school year with prevention and safety as our watchwords. We have spent much of this summer planning for our students to successfully return to in-person school instruction across LA County. This fall will be a joint effort between teachers, staff, parents, and students. Each school district has a COVID-19 prevention and control plan that describes the school's comprehensive approach to preventing and containing the spread of COVID-19 on campus. That includes a strategy for COVID-19 testing, an approach to identifying and excluding symptomatic staff and students from campus, and a plan or protocol for steps that would be taken immediately upon notification of school officials that any member of the school community test positive for COVID-19, including a communication plan, as well as recommendations for various types of school activities to keep your child safe and healthy throughout the school day. In preparation for school reopening and as an ongoing measure, weekly telebriefings have been held and will continue to be held with the K-12 sector to offer updates on protocols and developments with COVID-19 across the county and to answer any questions. Specific guidance has been given for each school level, along with after-school sports and other specific extracurricular activities. Requirements are reviewed often, and a strong communication channel has been established and maintained between the Department of Public Health, LACO, and all 80 school district superintendents throughout this past school year and this summer of planning. We have stressed the importance of consistent compliance with all requirements and the benefit of implementing the many recommendations we include in our reopening protocol, which increases the layers of mitigation and prevention strategies that decreases the risk of viral transmission and increases overall safety, such as limiting exposure between classroom cohorts of students to significantly reduce the transmission rate between classrooms and different grades of students, distancing measures, which will be applied where applicable and when they do not interfere with full-time learning opportunities for all students in regular school operations. As we move closer to the first day of school, we're working to support testing capacity at all school districts with resources available from Department of Public Health and LACO. And with the recommendation of prioritizing testing for persons without symptoms for all of those who are unvaccinated, and considering inclusion of testing for vaccinated individuals as resources allow. Currently, under the mask mandate, which is a requirement, all persons will wear masks indoors, regardless of vaccination status, while masking outdoors remains voluntary, although we do recommend masking in crowded outdoor conditions and when physical distancing cannot be maintained. The Department of Public Health has also worked to create a wealth of information. So I'll again plug the website Dr. Ugana had mentioned, vaccinatelacounty.com. It's worth repeating. We have community resource pages and toolkits of information for schools and other organizations. We want your students to be back in school. We know that being and staying informed is the best way to prepare. So I urge you to visit our website to look over information about the vaccine, masking, and available community resources. Now, schools may continue to look a little different this school year, certainly at the beginning of the school year, along with masks required indoors for everyone. Classrooms may be set up a little differently to provide some extra distance between desks. In the cafeteria, lunch tables may be further apart. But all of the sports, other after-school activities, and yes, everyone's favorite time of day, recess, will all be available with appropriate safety measures applied.
Thank you. Yes. Thank you so much, Dr. Gilchick. We're going to get right into the questions because we have received a lot of them. So I want to also thank all of our parents and everybody who's tuned into tonight's town hall, not just for participating tonight, but for all you're doing to keep your family safe and our community safe. I'm going to start with you with a question for you, Superintendent Thurmond. Why are you considering opening the schools if the COVID cases are rising? Oh, I wonder if we've lost. Let me come back to the superintendent because I noticed that he may have accidentally been dropped. But we'll come back. Dr. Eduardo, I think I'll just flip that question over to you. You know, why are we feeling good about opening our schools even if COVID cases are rising?
Yeah, thank you for that question. You know, we're confident that schools have done an excellent job following all the mitigation strategies to prevent the spread of COVID. We know that schools have had very little spread of COVID, and that if we follow all the layering of strategies such as wearing our masks, hand washing, the physical distancing, and really encouraging everybody who can get vaccinated, we're really confident that schools are safe places. I think looking at the data and the evidence, it tells us that schools are probably the safest place students can be to prevent the spread of COVID.
Yeah, thank you so much. I want to just add, you know, sometimes people say, and I understand the concern, you know, when we've had a lot of cases before, we've made a lot of changes at schools. You know, why are we not insisting on having all of those changes in place? We didn't have vaccines before. You know, in LA County, over 60% of the entire population now has received at least one dose of the vaccine. And among 12 and older, it's 70% in LA County. And those vaccines are super powerful. So you know, we are going to really benefit from all of the vaccinated people that are surrounding us and that are surrounding our children that aren't yet able to get vaccinated. And that's the difference of this go round. And that's why it makes it much easier to really move towards this full reopening that we're also excited about and that we know really will make a difference in the lives of so many children. I'm going to go on to actually Dr. Jagane. I mean, maybe you can help also. There's a lot of questions around this, around what's the science that we're pointing to, that we're using with regards to having children wear masks in school. Why would we ask for this when children being hospitalized from COVID is still a relatively rare event?
Yeah, that's a really interesting question. You know, going into the new school year as pediatricians, mothers, public health workers all want to keep our schools safe and open. And we just know that this new variant is extremely contagious, and we have to use every trick in our toolbox in a layered approach. We can't just rely on vaccinations and ventilation and masking alone. We really want to get every single tool together and layer them on top of each other. And we know that the older kids can get vaccinated, but the elementary school aged kids can't get vaccine. And we want to protect them as well, not only from illness, but also we don't want to interrupt their education as much. So it's really important for us to decrease transmission as much as possible in our schools to keep them open. Of course, the other huge benefit of masking is that it prevents other respiratory illnesses. So those respiratory illnesses also take kids out of school, and we're hoping that we'll see less of those as well and keep our kids healthy from those other respiratory viruses. And then finally, in Los Angeles County, we are asking every individual to mask indoors. So it makes sense that we would also ask the same in schools, where we have a lot of unvaccinated elementary school aged kids who are waiting for their turn to get vaccinated.
Yeah, thank you so much. And I think it's important to note, even though, students 12 and older are eligible to get vaccinated, we only have about 50% of them fully vaccinated still. So even in middle schools and high schools, we still have a lot of unvaccinated students. And masks are a layer. They've worked before. They're working now. As a matter of fact, we're not seeing the same explosion in new cases that's being experienced around the rest of the state. And it's because we do require a mask indoors, and we are all going to benefit from that extra layer. Dr. Gilchick, this is a great question. It's come in a couple of times. Are the same requirements that you listed applicable for our private schools? What should we do if our children are attending a private school where they're saying that masking is optional for all, regardless of vaccination status?
Thank you. First of all, I can say that the requirements and recommendations are exactly the same for private schools and for public schools and for charter schools and so on. It's the same reopening protocol that is on our website, part of our health officer order. So the rules are the same. If you're told differently, that may not be accurate. Someone may be pulling your leg. And the answer to the question is, if they are treating masking as optional, then that school may be out of compliance. Sounds like they'd be out of compliance with our masking requirements, and creating an atmosphere or an environment that would not be as safe as one that is properly following our guidance. There is, you do have options on how to respond to that. We will follow up and visit and enforce masking in schools. We always try to take a supportive and educational role first. We have a rather large school technical assistance team that is available to visit any school around the county to evaluate how they are implementing prevention strategies and mitigation layers. And if there is an issue with masking, we will certainly try to work with them to get them into compliance. However, if in fact they continue to be non-compliant, so it is possible for the school to be cited and fined. That has happened a few times in the past year, although usually it's not necessary. I'll share with you our public health complaint line with our environmental health division, which is a public toll-free number you can call if you have concerns about this type of situation. It's 888-700-9995. Thanks for letting me answer that.
Thanks so much, Dr. Gilchick. Dr. Eduardo, there's a lot of questions about how is mask wearing going to be enforced in our schools? What has been put in place? What can parents and students do if they're worried about masks not being worn in the schools, even though we all know they're required?
Well, the good news is that we really haven't had a problem with children refusing to wear masks. We've been in this pandemic now for 18 months, and the children are doing an amazing job wearing their masks. They're comfortable with their masks, and we really haven't seen a problem. But if we were to see a student that was having difficulty or refusing to wear a mask, what we really want to do is have a conversation with that child to figure out what the issue is. We're not looking to push children out of school or deny them their education. So districts are going to do everything possible to have a positive conversation with that student. If necessary, a conversation with their parents, bring in a counselor or social worker to help them understand what's going on and to really make sure that they feel supported. So districts will each have to come up with their own plans, but I can tell you every single district has a safety plan, is prepared for these types of situations that may occur, even though it will be very infrequently, because as I mentioned, children are not having a hard time wearing their masks. And we're going to make sure we do everything we can to support them and to enforce them wearing it. A last resort would be to exclude a child from school if they continuously refuse to wear a mask, and to provide an alternative educational setting for them.
Oh, thank you so much. I mean, we must have 10 questions about it. I think it's important to wear masks, and we thank all of you who understand how important that is, but they're worried that it just won't be enforced at schools, and they're worried for their children and their well-being. And similar to that, Dr. Jagane, I've got a question, a couple of questions around this, which is, I'd really like my child to be vaccinated before they go back to school, but they're not yet 12 years old. When do you think the vaccine for younger children will be available? And should I be keeping my child out of school until they're fully vaccinated?
Yeah, this is a very important question for me too, as I have two children who are also school-aged but not vaccine eligible. There are several trials right now that are enrolling or have enrolled, completed enrollment, testing children, giving the vaccine to children from 5 to 11 years of age. They're collecting data on their immune response to the vaccine. They're also really evaluating their safety profile very carefully, enrolling thousands and thousands of children, both with the placebo group as well as the vaccine group. And I unfortunately don't have much more data than everyone else here, but per the press briefings, Pfizer has completed enrollment and is hoping to have enough data to submit in the fall for an emergency use authorization for the 5 to 11-year-olds. And we're sure that the FDA will take that process of reviewing the data very seriously. And until we know that the vaccine is both highly safe and highly effective, we're going to take every other precaution to keep our children safe. And that means vaccinating all the adults in the communities, wearing masks, and really keeping them away from poorly ventilated, crowded spaces. So I feel comfortable saying that my children will go to school, but I'm very much looking forward to the day that I can get them vaccinated too.
Oh, thank you so much. And this is probably a good transition to a question for Dr. Gilchick, because I think parents are also recognizing that that all the students are not going to be vaccinated, and they have a lot of questions about these other layers. Will students be sitting next to each other in class? Are there room capacity limits now? And are students going to be allowed to eat in the classroom when they take their masks off if they're not sitting at least 3 feet apart from each other? It's a lot of questions, Dr. Gilchick. I think you're on mute.
Okay, thank you. Yeah, I had to double check that. Yeah, that's a lot of different questions. So yes, the best answer, or the first answer, is it probably will vary somewhat from district to district and school to school. But let me start with our recommendations that we have in our protocol, and that we share with school leadership through our telebriefings and our technical assistance team and so on. So we recommend that schools continue to implement physical distancing measures as feasible, as long as it doesn't interfere with the ability to offer all students full in-person instruction and with other normal school operations. Some schools will have very full classrooms that will probably look like pre-pandemic conditions, although everyone will be wearing a mask, we know. And there may be very little distancing between students in those classrooms. Other schools, depending on their space capacity and their resources, may be able to create more distance. But since it is a recommendation, and there are some schools that will not be able to create a lot of distance in the classroom, this is yet another reason why universal masking for everyone indoors, in the classroom and elsewhere indoors, is really going to be critical. The state of California, in releasing their guidance, has looked at the available research and science and has concluded that physical distancing is an effective strategy, but not absolutely necessary if everyone is properly wearing a well-fitted mask. Now, you ask about eating in the classroom with very little distance between students. That's a great question. Obviously, the children who are eating are not going to be wearing masks during that activity. And eating and drinking, or really any time a mask is removed with no distancing at all, is not our recommendation. Certainly, there's better ways to handle that. Move eating and drinking outside if possible. If it's indoors, create more distance. If you can't create more distance, consider using other barriers, right? Impermeable barriers to block exhaled droplets. This is so timely because I will tell you, we just had a meeting with a school district yesterday to discuss the situation about eating breakfast in the classroom. So they generally serve breakfast, like in the first 15 minutes of the instructional day in the classroom, and they're properly concerned about the safety of it. So again, all schools are concerned about providing safety. They are consulting with us. They're trying to get the best advice. Ultimately, they decided at this time, at least to start, the best conclusion would be to provide next day's breakfast to students at the end of the school day, at least now while transmission is very high, so students can eat breakfast. They'll have it the next day and can eat it before they arrive. That may be, I think that's a creative and great compromise, considering the amount of risk that might be produced if you have a classroom full of students sitting close together, all eating without masks on. So again, there are ways to, there are ways to mitigate these situations.
Yeah, thanks so much, Dr. Gilchick. And I do want to emphasize that, parents should ask a lot of questions. This would be the time, talk with your school administrators before school opens and get answers to these very important questions. And also, help offer solutions, creative ways for us to actually reduce risk. Because, from our experience, teachers, parents, and students all can help sort of do the problem solving on making sure our schools are reopening with as much safety as possible. Superintendent Thurman, there's a few questions that we would love your help answering. One question that has come up a fair amount is around what kind of mandates might there be going down the road for teachers and staff at schools, particularly this question is coming up from a whole bunch of our listeners who have children in elementary school. They want to send their kids to school, but they want to make sure that the teacher and the staff around those kids are fully vaccinated. And they're just wondering, is the state looking at a similar mandate as the one that they did for healthcare workers for teachers and staff at schools, particularly at elementary schools?
Thanks, Dr. Pereira. This is the question that comes up in every conversation that I have everywhere in the state. The reality is there is not any mandate for vaccines, for example. Such a mandate would have to come from an act of the state legislature. And I can tell you that there's been no bill introduced that would create a mandate. Now, there has been some discussion from one legislator who has said that she's considering introducing a piece of legislation that could become a mandate. I just want to note that the state legislature is going to be wrapping up its cycle, its session for this year in mid-September. And so they're on a recess right now. And so that means that in order for there to be a mandate, there would have to be a bill introduced in the next few weeks. It had to find a way through both of the houses of our legislature and signed by our governor by mid-September. Most would think that that may not be able to happen given the amount of time we have. Given that schools are opening in most places, some are already open and many are opening next week and the week after, I would just encourage us to not wait for any vaccine mandates, and that those who can get a vaccine should please get the vaccine now, because even getting a vaccine now would really help some of our students, even though it takes 5 weeks or so, as they say, to have full, the full impacts of the vaccine. Getting one now makes a difference. I'd like to also clarify what the state of California has done for its workers. Through the Department of Public Health, the state of California has said that all state employees have to either show proof of having a vaccine, and if they don't show proof of having a vaccine, they have to take COVID testing to return to work. So there has not been any mandate of any state employees having a vaccine, but the mandate is show your vaccine proof or you have to take COVID testing.
Thank you so much. And I think that, the parents that are sending in these questions, we really appreciate them. And we appreciate, your desire to really know based on the science. We keep talking about how important it is for everyone to get vaccinated, that a good layer of protection for your child who cannot get vaccinated is having the adults in that classroom, make every effort to go ahead and get vaccinated. So that, in fact, that reduces some of the risk.
You said it so much better than I ever could, Dr. Ferrer. Thank you.
You said it great. I just always want to give a lot of credit to the questions we get, because they are the right questions that we all need to be asking. And you're asking people who really take seriously our obligation to try to build in safety. So we appreciate these questions about how can that happen, in the framework that we're working with right now. What else can be done to actually, add those extra layers? Go ahead. Go ahead.
Dr. Ferrer, I was just going to say, you're right. Thank you to the parents and the families. I literally am taking notes because these are such great questions. And I think that they help us to think through all these questions to the state. But I think Dr. Dorado actually has a follow-up to this question that I think is very relevant and might be helpful for parents to hear.
Thank you, Superintendent Thurman. The really good news is that our educators care deeply about their students and want to do everything that they can to keep them safe. And of course, they're also concerned about their own safety. So we surveyed our 80 districts and found that over 83% of our district employees have been vaccinated. So the majority of the teachers and counselors and administrators currently at our school sites have already taken that important action of getting vaccinated. And for those who have not, for whatever reason, they will be required in most districts to show that they are continuously or regularly being COVID tested to ensure that they do not have COVID. Thank you.
Yeah, thank you so much, Superintendent Eduardo. Dr. Yagane, I also, there's a whole host of questions related to the fact that we all know now that the Delta variant, not only is it much more infectious, but that there are small chances that people who are fully vaccinated can become infected. There's a whole set of questions here about how would we know that someone who has been fully vaccinated has the Delta variant? Like, what are the strategies we're going to use for identifying amongst fully vaccinated people whether or not they're infected, particularly in a school environment, but not only in the school environment?
Yeah, so that's a great question. We are seeing some people who are vaccinated have symptoms of COVID-19, getting tested appropriately, because that's what you do when you have symptoms of fever, cough, headache, nausea, vomiting. Those are times when you should get tested, and testing positive, even though they're fully vaccinated. And what we're finding out is that the Delta variant seems to be causing higher rates of infection in fully vaccinated individuals. That being said, the vaccine seems to be really highly effective, fantastic at preventing severe illness or serious illness, meaning that most people, and I think Dr. Ferrer has the actual data, but most people, I would say more than 90%, do not require hospitalizations. And again, we rarely see someone who's fully vaccinated succumb to disease. So, people can unfortunately still get infected, but the vaccine is meant to really prevent people from getting severely ill. And it's doing a fantastic job of that. So we are not seeing vaccine failure in any sense. There is some thought that, with longer times of, we're kind of monitoring this very closely. So if you go out 6 months versus a year versus 2 years, will there be need for additional doses? And I think that data is being collected and being evaluated really carefully by all of us.
Oh, thank you so much. Dr. Gilchick, I think really, sort of following up again on this theme of how to manage safety in a school with lots of different people. There's a good question here about what are the protocols that are required at schools, Dr. Gilchick, around contact tracing and communication to the school community if either a student or a staff member tests positive.
Yes. First of all schools are required, this is one of the requirements, are required to report any case to us, even a single case in their school community, whether it's a student, a teacher, administrator. They're required to report to our public health department within 1 business day. If it's a cluster of cases, 3 or more, within a 14-day period, they must contact us immediately. They must call us immediately, as this is a potential outbreak that will need to be investigated. So the public health department becomes involved right away, provides instruction on how to identify who would be considered close contacts, possible exposed individuals, unvaccinated people who are close contacts must quarantine, right? Must be excluded from the school for up to 10 days. There may be a possibility of shortening that with negative testing, but they will be quarantined outside of school. Vaccinated individuals do not necessarily have to leave school to quarantine, but they do need to go get tested just to make sure that they're not having a post-vaccination infection because of their exposure. So that is handled, very quickly, expeditiously, and public health monitors that and makes sure that that is implemented. As far as communication, I really think that's a great question, because we are completely in favor of transparency and keeping the community informed about what's going on. Now, and we have model template letters that to help the school with communication in terms of sending it out to the families that are attending that school. Now, you're not going to get full detailed information on who has COVID-19 infection and where exactly exposure happened, because there are HIPAA rules and there are privacy and confidentiality rules. And we all, both the public health department and the school, must abide by those confidentiality rules. But what you will be shared and what you will be assured of is if and when there is an exposure incident, what the school and public health department are doing in response, and when the case or exposures have been cleared from the school, when there's no evidence of any more transmission from this incident in the school, and when it's safe to have students back in the school and in the classrooms. So all of that information will be shared with you, just not necessarily specific details about the people who get infected and exposed.
Yeah, thanks. And just to clarify, if your child or you had an exposure, you will be notified that you had an exposure. So that will not be general information. You will get notified either by us or by someone from the school administration or the school nurse's office that you or your child had an exposure. You'll be told what to do depending on the vaccination status of you or your child. You will need to go ahead and get tested, but you will not, as Dr. Gilchik noted, you will not be given information about who the person was that was positive, because that is protected information and nobody's able to share that. But you will be notified that you had an exposure. You'll be notified the date that you might have been exposed, and you'll be notified about what actions you need to take because of that exposure. And one action everyone needs to be prepared to take is if you've had that exposure, unless you are recently, within the last 90 days, recovering from being infected with COVID, you will need to go get tested. And the school will help arrange for that to happen. So you're not going to be out there by yourself trying to figure this out. The school and the Department of Public Health are going to work to make sure you have all the resources you need should there be an exposure at the school. And maybe Superintendent Eduardo, I think we also have a whole host of questions from parents who are anxious. They're anxious for themselves and they're anxious for their children. And they would love advice on how do they manage that anxiety and manage their child's anxiety when for many this is turning into a very stressful time. Although they're anxious to get their children back to school, they are filled with anxiety, and for some of them, they have noticed that their children are also anxious. So I don't know any tips there.
Thanks, Dr. Ferrer. You know, it's totally normal for parents and students to feel anxiety around this pandemic. This is something that we've never experienced before. And there's still a lot of unknowns, and it's a scary situation for parents and students. And I'd say the best thing that we can do to address that anxiety, especially with children, is to, one, have a good conversation, age appropriate, and talking to them about what this pandemic is and explaining all of the things that we do to protect ourselves from this illness. So, of course, talking about how we wear our masks and how we wash our hands frequently, and many people are getting vaccinated, and the adults at school and around them are here to take care of them and to protect them. Children also look to the adults around them to decide how safe they are. So it's also really important for parents and adults to handle their anxiety and not to stress their children out. If children look to their parents and see that their parents are calm and telling them that things are going to be okay, that we'll get through this together, they'll be more likely to be able to cope with it. But also doing things like exercising and going outside and practicing mindfulness and self-care. All of those things are really important to help address some of the stress and anxiety. And I just want to say that schools have hired a lot of additional mental health support, counselors, social workers. We're partnering with the Department of Mental Health, nonprofit organization. We all realize that this is a stressful time, and there are plans in place to make sure we're assessing the overall wellness of our children and our families, and to offer supports if they should need it.
Thank you so much. Superintendent Thurman, I know that you've gotten the same question over and over about sort of how anxious people feel, particularly with the Delta variant about coming back to school. We'd love some wise counsel from you as well, and I know that parents and students would appreciate that.
You know, Superintendent Dorado and I are both social workers by training, but I don't think I could add anything to what she said. I thought it was really the perfect remedy. And I can only emphasize what she said. I think it's important for us to acknowledge it's okay to have fears. And I think when we listen to children, we empower them. And when children have fears, they can tell us what it is that they fear. And all we can do is tell them the things that we know in terms of how to be safe and how to be successful. Children are so, as you all know, children are so incredibly resilient. And I am so proud of what our students have done during this pandemic. Even at the height of the pandemic in the fall, when the cases were some of the highest that we had seen, thousands of students all across the state were going to school every single day. They used the combination of COVID testing and wearing masks to keep everyone safe and to keep the spread and the transmission very, very low. And so we can't control COVID, is one of the things that I always say, but we can control what we do to respond to it. And our kids are resilient. If they have fears, we should listen to them. We should talk through our plans for how we can be as safe as we can. If they tell us that they're not feeling well, we should take the steps to see how we can support them by talking to their doctors and seeing if there's anything that's wrong. Otherwise, we have to continue to move forward with the plans that we have for safety and to support them and to recognize that they're very, very resilient. And they will also appreciate being heard when we as adults are listening closely to them.
Thank you so much. And I feel like the advice from both of our superintendents really is going to be helpful for so many people that are struggling, both parents and also staff and teachers coming back into the community. This is a time, unfortunately, because we're living through a pandemic where there is a lot of anxiety. So I appreciated the advice as well. So thank you both so much. Dr. Yagane, I also, have a few questions here that, again, I think it would be great if you could answer. I'm going to try to put them all into sort of one larger question because one of the other strategies for reducing anxiety is really getting your questions answered and having good information about the science behind both this virus and the vaccines. So we do have a few questions really wanting more information about what have we learned about how COVID is spread. People are noticing that we don't just talk about droplets anymore. We also talk about aerosolized spread. And they're wondering, what do we now know about how COVID is spread? And then how do these vaccines work to protect us? So, I know they're both big questions and we don't have a lot of time, but I think they're complementary to each other. How this virus acts and interacts with human beings, and then what the vaccine does to interrupt that.
Thank you so much for that question. So the virus itself, SARS-CoV-2 or severe acute respiratory syndrome coronavirus 2 is the name of the virus, and it is spread from human to human by either larger droplets, we call them droplets, which are larger particles of water, or aerosols, which are very small particles of water that carry the virus from person to person. And it seems like most of the time you have to be in close contact with another human being, and they have to be producing these droplets, and you have to have that interaction with them, and then they land on your mucosal surfaces, and you either inhale it in or you rub your face, and that's how it enters your body and infects your cells. As far as droplets versus aerosolization, there are activities that we all do that produce aerosols, like singing, playing wind instruments, shouting. In that situation, the droplets of water can travel further before they drop to the ground and gravity puts them to the ground. So it really depends on what kind of situation you're talking about. But in general, it seems like if you're in a well-ventilated space, we don't see a lot of the airborne aerosolized transmission. It can happen if everyone is singing, but it's usually in poorly ventilated spaces with crowding. But the way that the vaccine really works is that it decreases the amount of virus circulating in a vaccinated person's body. And then the way that the immune system actually works if you're the vaccinated individual is that you have antibodies against the spike protein, the little projections on the coronavirus. And the antibodies then cover the virus and prevent it from entering your body. So that way you can be fully protected. The other way that we think that the vaccines work is that they teach your immune system how to fight it, even if you get exposed much later. So that's mostly your memory cells, your memory immune system, your T cells. And so even if you don't have antibodies circulating in your body, your T cells, they remember how to produce antibodies. And the next time you get exposed to the virus, they can help prevent you from getting sick, severely ill, hospitalized, or from dying. So that's my basic mini science review on how coronaviruses work.
I think that was really helpful, and I'm impressed that you were able to cover so much with such a short amount of time. Dr. Gilchick, I think the follow-up question to that is, given that there are so many students that are not able to be vaccinated and that this virus can be transmitted when people are close together, what is the best advice that you can give parents about how they can help make sure that the school environment is safe for their children?
Sure. Okay, here's a few tips. The first thing, of course, is if your child is 12 years of age or older, please get them vaccinated, as well as everyone else in your household who's eligible. That's absolutely, that would be one of the biggest things you can do. But we know right now, at least, children under 12 don't have that option. So for the most part, in elementary schools, we're not going to have children who are vaccinated. That's very clear. The other thing you can do, which is extremely important, and this is something you can do right at home, is every day, just do a quick little screening. Check your child for how they're feeling physically. Do they have any signs of illness? Any signs of respiratory illness? Any fever? Anything that could be consistent, possibly with having COVID-19, or for that matter, another respiratory illness. We really don't want to spread other respiratory illnesses in school either. And the take-home message is, if your child is sick, keep them home. Keep them home that day until they're better. That's one of the best ways to make sure we're not introducing the COVID-19 virus or any other respiratory illness into the school. Some of the other things which have already been covered are make sure your child is accustomed to wearing a mask throughout the day. Share why that's so important and why it's important that they wear it, while they're indoors at school, except for very specific activities like eating or drinking. And I think that probably is the most important messages. Really.
Oh, thank you so much. And then, perhaps, Dr. Eduardo, there's a whole host of questions as well around what happens if there's a lot of students in a particular classroom or in a school who do either test positive or are close contacts and need to be quarantined. Are schools going to be set up to provide those students with distance learning, online learning opportunities again? What are the districts doing to be ready for that? And how is the state also? I think there's questions here about how is the state able to support that distance learning should there be too many large outbreaks in a given school district?
So the good news is that districts and schools are already prepared for possible outbreaks. Districts have, as was mentioned by Dr. Gilchick, have been required to submit a safety plan. And the Department of Public Health has come out to visit schools and to actually see what they're going to do if there is someone who tests positive, where that student or adult will be isolated from other students and anyone else. So those schools are prepared and required to have that in place. However, you know, the law changed recently because of COVID around the requirement to offer an alternative form of education in case there is an outbreak and students are required to quarantine and stay home, or for families that may have a child whose health or immune system is compromised and they don't feel safe sending them to school. Every district is required to offer independent studies, which is basically a specialized plan for that student where they can continue their instruction through distance learning, through live instruction with their teacher to make sure there isn't any disruption to their education.
Superintendent Thurman, I don't know if you wanted to add, because I know the state has also done a lot on this.
You know, once again, Superintendent Dorado has really covered the key points. I think when the legislature created the new laws for independent study, they were recognizing that there might be students who, for medical necessity, for example, might need to have an alternative to in-person instruction. You know, they also recognize that the last time that our students went into distance learning, our state and our nation was woefully unprepared for that. And that's no one's fault. It's just a reality that in California, 1 million students were without a computer. And even to this day, there's 1 million students without access to high-speed internet in this state. And so the way the independent study law has been shifted and changed is to recognize that it's an option for students to have, but students have to have the basic tools to be able to participate. They have to have access to a computer and reliable internet. And I know that all the districts are making that available, and there's money in the state budget to make sure that students have access to those things. They have to have live instruction with their teacher, and they have to have the same quality of instruction that that they would get if they were in person. So what I'm trying to say is independent study has been redesigned to ensure that for those students who will participate in it, and they have to contact their local district to start that question, that they will have some guardrails to make sure that they don't have a negative experience. You know, independent study should not be sort of equated with, well, they're not going to get rigor, they're not going to be supported, they're not going to be successful in their learning. It's intended to provide an alternative when a student needs it, but there should be those same guardrails, and they are built in place to ensure that the quality that a student receives is also the same quality, because they're still being guided by their teachers. There's nothing more powerful to support learning than the work that our teachers provide to our students. A computer cannot replace a teacher, but an independent study structured in the way that the law intends means that students get live instruction, synchronous instruction, they get lots of support. And if we notice that a student is struggling in independent study, the school then has to have a conversation about helping to transition that student back to in-person instruction and getting them the supports that they need.
Thank you. I know that really helped, I think, because we actually had lots of questions about what's going to happen if the schools have to close, or my child's classroom gets quarantined for a while. So I think that provides our parents and students with a lot of really good information. Doctor, I know we only have time for a couple more questions, but I think this is an important one, Dr. Gigane, is really, and again, a few questions came in on this. I keep hearing that kids don't really get COVID, or if they get it, they don't really get sick. What's the truth around this? And as a parent, what should I know about what the symptoms might be that my child would exhibit should they get infected?
Yeah, so that's a really interesting question. We know that kids can get sick with COVID, and hundreds have died with COVID-19 as the cause. And so it's really important to make sure that we all understand that luckily, most children are able to survive the infection with little illness. Many do get very sick, and we do have hundreds of children probably hospitalized in California at this point with COVID-19. So just something to keep in mind is that, statistics mean one thing, but when it's your child, it's your entire world. So even if, it's 95% of children who are this age do well, if it's your child, you want them to definitely get that 100%. You want that guarantee that they'll do well, and the best way to do that is to get them vaccinated. The kids who can't get vaccinated right now, we're doing everything to prevent infection, because again, we are trying to prevent every single hospitalization, every single illness, as much as we can. And if we can do it, we should do it until they also have access to the vaccine. So
Can you talk a little bit about like signs and symptoms? What should parents watch out for?
So it depends.
How would you know if it was COVID or a cold or? We have a lot of questions about this, Nava. Sorry.
So difficult. It's so difficult because children, COVID-19 has a wide range of presentations. Some people are asymptomatic. They don't have any symptoms. Some people will have fevers and headaches and won't actually have the respiratory symptoms. So again, I think that anytime you have an exposure or some sort of situation where you work with a lot of people, it's better to err on the side of being cautious and to go ahead and get them tested. But the reason, the most common symptoms are very similar to adults. It's fever, cough, headaches, and then again, some GI symptoms. A lot of kids will have nausea, vomiting, diarrhea. And then in the older categories, I've been hearing from a lot of my colleagues that they're having fainting. So just think, it's very difficult. I think it's just always better to err on the side of caution and just get a test. And that way you know for sure.
And we also always encourage
To our audience that is tuning in, it appears that we are having some technical difficulties with Dr. Ferrer. Please stand by momentarily. Thank you.
While we're waiting for Dr. Ferrer to come on, I was thinking, one of the things that, I worry about or helps me worry a little less is when schools use outdoor classrooms to accommodate learning. And I don't know if any of the panelists are aware of any of our schools in LA County are planning to use outdoor classrooms and outdoor education, which is a great thing in general, just to support students becoming stewards of the environment, but also has proven to be a really incredible COVID mitigation. The state has provided money to schools to use for all kinds of things, including creating some outdoor classrooms. And, I learned something from our students at a lot of our schools. People always say, well, they can't wear masks for long. In a lot of schools, I've noticed that students will sometimes ask for a little break, and they can go outside and just take a little break and take their mask off. And, I learned that from students and teachers as a best practice to support our students in doing the things that help to keep them safe. But I don't know if anyone knows on the panel if any of the schools, the 80 districts, are planning to use some form of outdoor education. But that's certainly, if they're not and they're listening, that would be a great COVID mitigation strategy.
Yeah, I can answer part of that. Most of our districts are looking at the use of their facilities outdoors, whether it's classrooms, playtime, finding ways to engage students in outdoor activities as part of their instruction is definitely something that we're doing. We see districts that are building gardens and spaces where children can have the opportunity to learn about the environment, to learn about gardening and healthy eating. And many of our districts are thinking about using spaces that they currently have outdoors to provide instruction.
That's awesome. Thank you so much.
Yeah, and we also, I should also say, we released an outdoor learning guide to provide information and resources to all 80 of our districts on how they can create those kind of outdoor spaces.
Fantastic. Dr. Dorado, I don't know if you've had a chance to talk about community schools. I just think that there's such a great thing that LACO is leading. Have you had a chance to talk about that at all?
Well, we haven't really talked about it in response to COVID, but basically community schools is an effort of really strong collaboration between schools, county departments, and nonprofit organizations to make schools the hub of community services, to provide all types of resources that can help reduce any of the barriers that are preventing students from learning. So during COVID, these community schools were able to get devices, provide internet access, provide food for families that were struggling with that, helping families who are facing eviction, just dealing with a lot of the anxiety and the mental health issues that a lot of our students are facing. So it really was a godsend that we had these community schools that were supported by our Board of Supervisors and the Department of Mental Health and other county departments to say, let's just all work together and leverage the resources we have and push everything out to our schools and our school communities and support our students and families during this very difficult time. So thank you, Superintendent Thurman, for being such an advocate for community schools. It's definitely something that we're trying to scale out across the county.
It's one of the many things that the state has invested significantly in the state budget. We want to come and visit some of the community schools in Los Angeles County. I think they're as a way to convene and inform other districts that want to build them. This webinar has been so informative. I love our partnership with LACO and with LA County Office of Health. I've learned so much from the questions and from the answers from all of you, and Dr. Yagane and Dr. Gilchick, thank you, and always Dr. Duardo. You know, the state, if there are things that you all need from the state, and if there are things that you're hearing from parents and constituents that you need from the state, we always want to hear that. I think it's a very special partnership that we have between the state and Los Angeles County. The amounts of money that have been invested through the state budget are record and historic. And they do envision all the things that Superintendent Dorado just talked about: outdoor education. There's money to support COVID testing. There's money to support technology, billions for technology, something that Dr. Dorado talked about earlier. There's so much money to support mental health supports and wraparound supports for our students. Probably $3 billion to go into, how we support children from birth to 25 in terms of wraparound supports. There's also money to create a system of universal TK so that our 4-year-olds can go to school, many of whom this might be their first experience, and essentially not have to pay. There's more money to go to our childcare programs for our youngest children to also get structured programs so that parents can work, and so that there are support programs for our children to have exposure so they'll be ready for kindergarten. The last piece I want to mention is universal meals. And I want to commend the 80 districts in our state, because we did a short tally. At one point in the pandemic, we noticed that our schools throughout the state, including the 80 districts in LA County, had provided some 500 million meals to students during the pandemic. We know that families have lost jobs, loved ones, homes, and that there's a lot of need and there's a lot of insecurity. And so now through the state budget, we also are able to provide universal meals where any student who wants one, regardless of their income or their background, can get a meal. All these things I'm just throwing out to say that we're all leaning in together, county and state, our districts together, to figure out how to prepare for this thing that is incredibly difficult that we've never done before. And I believe if we keep leaning in together, that's how we're going to get there. And in the process, figure out a way to make education in our system even better. I'm just sharing things, and also stalling to give our host a little time to get back on. We've had such a great host and we have such great panelists, and I just thought I would share those things. And so, Dr. Ferrer, when you're ready, you just let me know. I'll step out of your lane, I just wanted to share some of those great things that the state and the county and our districts are partnering on together.
Yeah,
Thank you, Superintendent Thurmond. I'm going to open the floor now for some final thoughts. We'll start first with Dr. Yagane. Dr. Yagane?
Thanks so much. Well, I again want to thank everyone for their questions and everyone on the panel. I do think that school and school supported programs are fundamental to a child and adolescent's development and well-being. And really, schools are the beating heart of so many of our communities. So we need to prioritize keeping them safe and keeping the children engaged in these activities. So I would again want to encourage everyone listening to this to please make an appointment to get vaccinated if you haven't yet. It's our most powerful tool in trying to mitigate this pandemic in a way that makes our lives a more normal version of our lives. So again, the website is vaccinatelacounty.com to make an appointment. Thank you.
Thank you, Dr. Yagane. Turning the floor over now to Dr. Gilchick.
thank you very much. I guess I'll just try to quickly make a couple of points. The first is that I think we know that distance learning has had its negative consequences for many of our children. Schools are a safer place for children to be than many other settings in the community, right? In terms of risk, just in terms of COVID-19 risk. And I think we honestly believe that your child will be safer, healthier, and happier attending school in person with his or her teachers in the classroom. So I think that we just hope that, you will give our education heroes, our educators, a chance to prove that and bring all our children back to school full time. Thank you.
Thank you, Dr. Gilchick. Superintendent Thurmond, any last thoughts?
Analysts and to the people of Los Angeles County for allowing me to be a part of this webinar. I would just say that in addition to my job, I'm a parent of students in public school. I'm the dad of two teenage daughters who I'm very proud of. And I appreciate the concerns that were raised here tonight. I think they're fair and they're legitimate. And I think about them too. My daughters are also looking forward to the return to school. And they both have received their vaccine. And I can tell you that, and I've also been vaccinated, and I can tell you that, I had questions when it came time to get my vaccine. But what I've learned is that it doesn't hurt. It doesn't cost anything. You don't have to have insurance. No one's going to ask you about your immigration status or residency, and that it can literally save a life. And so I hope that those who can get a vaccine will get one until our youngest children can. I hope that those who have questions will continue to ask. You have an incredible leadership group here in Los Angeles County, and I'm very happy to partner with all of them and all of you. And I believe that we are going to build education back better, and we'll take it one day at a time. We'll just keep monitoring the conditions every single day and doing the things that we know will help to keep us safe. So thank you for listening tonight and for inviting me to be a part of this incredible community.
Thank you, Superintendent. And finally, Dr. Eduardo.
I just want to reassure all of our parents and educators that safety is our #1 priority and that we're going to be doing everything to keep our children and all of our staff safe. We are absolutely in this together, and I want to give a real big shout out to all of our education sector, our superintendents, our teachers, our classified staff, our certificated staff. Everybody has worked really hard to ensure our children continue to receive a quality education. I want to encourage everybody who can to please get vaccinated so that we have the least amount of disruption possible and to ensure the safe reopening of our schools. Just want to welcome everybody back to school. Back to school is an exciting time, and I can guarantee you that the safety of your child will be our #1 priority. Thanks to the rest of the panel and to Superintendent Thurmond and Dr. Ferrer. for doing this. And please continue to ask questions and know that your districts are here to support you. Thank you.